Millions of people out there at risk of losing their Medicaid and therefore their Medicare and their Medicare plans. And so we're going to talk about that today. And I'm going to give you a call to action to make sure you reach out to your politicians, make sure that doesn't happen to you or someone you love or a relative or somebody in your community. Let's reach out to your politicians and make sure this doesn't happen. And I'm also going to make sure that if it does happen, we'll give you all the options of what you can do if the states and the government start cutting back on Medicaid. If you're new to my channel, my name is Ed Weir. I ran the third busiest Social Security office in the country. In my semi-retirement, I'm helping you get everything from Social Security, Medicare, and Medicaid that you're eligible for, that you earned, and also making sure those benefits don't stop. In my semi retirement, those are my missions in life. Okay, so let's talk about this. This is Medicaid. We'll go through the list: Medicare, what the difference is between Medicare and Medicaid, talk about the Medicare Savings Program, which a lot of people receive that really help them out. And then other resources for those out there struggling. So let's go through the entire list and let's see what we can do to help you out. All right, so what are we talking about here? There is an attempt just introduced. House GOP, the new Congress, the 119th Congress, put in a list, I guess a wish list of things they want to cut, which includes Medicaid, the Affordable Care Act, climate measures. I'm not going to get into the AC. I'm not going to get into climate type stuff. I'm going to focus on Medicaid and Medicare. So this is a political article that talks about kind of their wish list, and the wish list is actually included. So we're looking at trillions of dollars of cuts to Medicaid, and that's about 40% cut to Medicaid. So for those that don't know or are unfamiliar with the difference, basically Medicare and Medicaid are health insurance programs. Medicare is the one you sign up through the Social Security Administration. That's the Part A. The Part B, Part A is free for most people. Part B is this year it's $185. And then you've got Part C, which I hate it being called Part C, but those are the Medicare Advantage plans. I always recommend Medicare Supplement plans, but C is Medicare Supplement, or excuse me, Medicare Advantage plans. The Part D are the prescription drug plans. Okay, so that's Medicare. You pay into when you work and pay FICA. Part of the FICA that you pay goes to Social Security, and the other part goes to Medicare. So those are programs that you paid through your taxes, payroll taxes. Medicaid. In some states, like California, they call it Medi-Cal because, hey, California always tries to do something interesting, different, I guess. But Medicaid is administered by the states. And that is a welfare based program, low income, low resources for people on disability, as well, people that even on Medicare. So there's millions of people that actually have Medicare and Medicaid. So let me throw the numbers up there. So right now we're looking at about over 67 million people receive Medicare, Part A, Part B, or whatever. About 80 million people receive Medicaid from the states. How do you apply for Medicaid? You have to go to your state agency. Don't go to the Social Security Administration. They can't help you with Medicaid. You go to your state. They're called Department of Welfare or Department of Social Services or whoever handles whatever the company or the agency in your particular state handles the Medicaid. And about 80 million people are on Medicaid. And then there's a category called dual eligible. As the name implies, dual eligible. That means they're on Medicare and Medicaid. They're receiving both of those. So that's about 13 million people that are dual eligible. And then there's also about 5 million of those that are also what's called Medicare Advantage dual eligible. When you have Medicare and Medicaid, if you have a certain level of Medicaid, you're also eligible for Medicare Advantage dual eligible plans. And those are the ones you see advertised all the time about, the grocery cards, $100 a month or $500 a month or, thousands or with, free ice cream and unicorns. There's a bunch of companies out there and Medicare insurance agents that do a kind of a scammy job on advertising those. The Center for Medicare and Medicaid Services is supposed to be clamping down on those faulty advertising, kind of bait and switch. What they do is they take the best of those in the country, and then they advertise it to the entire country. And you call them up, and they say, "Well, unless you live in this particular zip code in this particular part of West Virginia, you don't get it." And then they've already got you on the line, and they do their their quick sell and hard sell. So, those cards do exist. So if you know anybody that's struggling to pay the Medicare Part B premium, that $185, that's where the Medicare Savings Program comes in. So if you have Medicare and you're just having a hard time paying that $185, make sure you or someone you know reaches out to your state Medicaid office, have them apply for Medicaid, and if they get the higher levels, then that kicks in the Medicare Savings Program, and the state Medicaid will pay for your Part B premium, and you'll be dual eligible. And then you also hopefully be able to get the Medicare Advantage dual eligible plan if there's one available in your area, and it's gives you some extra money for groceries. I partner with Chapter there. You can reach out to them to see if there's one available in your area and see what kind of grocery cards, and they do all kinds of provide transportation and some other things. Really depends on what's in your neck of the woods, as they say. But that is all being said based on, is this going to continue in your area? So if we're looking about 40% cut, so basically the Medicaid is supported by the federal government tax dollars. And so the current Congress wants to cut those funds to the states. And the states, a lot of states out there are already having a difficult time keeping up with their budgets. These are particular states. There's 9 states that have like what's called trigger laws. So if the federal government cuts those Medicaid funds, these states will automatically kick people off in force on Medicaid. So this is the call to action time, and it's not only these states. These are the ones with the automatic trigger laws that kick people off. But there's also other states that, because of their budgets, if they get less coming in from the government to support health care for low income workers and the elderly and disabled, then they will have no, I guess, no alternative than to cut people off Medicaid, raise taxes, whatever the case may be. So this is what we need to do. I'll put the little call to action. Reach out to your senators, representatives. There's the switchboard of the U.S. Capitol. There's the switchboard for the president. Go on to their websites and go on to their social media. All your Congress people, go onto their social media, give them a call and tell them what you think. Visit their local offices, call the local news. Share this video, share this call to action with everybody. And regular viewers to my channel know that we've got a regular thing. We want to save Social Security and make sure the cuts don't happen in the future, which inevitably they will happen in the next 9 years or so, or sooner, depending on what happens in the next presidency. But we want to smash the cap so everybody pays Social Security taxes like everybody else, like the rest of us. If you make over 176,000, you stop paying Social Security tax on any money you earn over that. A lot of people don't realize that. And then also ask your politicians, while you're saying, hey, support Medicaid, don't cut Medicaid. What are you doing to improve customer service at your local office? And what are you doing to prevent cuts in the future? So take a screenshot of that, save that, whatever you have to do. Reach out to your politicians and let's make sure that people in your area are protected and have the health care they need. All right, so those are the automatic states that will cut those, and again, all the other states are going to be in kind of difficult, situation if they lose that federal funding to support their Medicaid population. And then there's also the Congress is also trying to put work requirements on people on Medicaid. So if you're receiving Medicaid, they're going to have work requirements, even though a vast majority of people that receive Medicaid already work, but they work in low-paying jobs, and their employers don't provide health insurance, or they're too small of a company, so they have to get Medicaid to get health insurance for them and their families. And the estimates up to 90% either have an employer, they're disabled, they're going to school, or they're taking care of, an elderly person or disabled person. About 90% of the people on Medicaid rolls, it's not as though they're just, everybody just sitting around doing nothing. They're working, taking care of someone that caregivers, and so this is Medicaid is important for those people out there, and we need to make sure that continues. Um, the Medicare open enrollment period is also going on right now. If you have a Medicare Advantage plan, this is the time to change it. January, February, March. You can change it one time if you have a Medicare Advantage and you want to switch back to original Medicare, original Part A and Part B, and get a Medicare supplement. This is the time to do it. Depends on your particular area and your health and everything, but you will have to go through health underwriting and determine whether you can get a Medicare supplement plan, but it doesn't hurt to try. I always recommend Medicare supplement plans because you don't have the prior authorizations, you don't have the networks, but they're not for everybody. If you have a Medicare Advantage dual eligible plan, if you have Medicaid, then you can't get a Medicare supplement plan because Medicaid is already paying for predominantly most of all of your health care. So you can't get a Medicare supplement plan. And there's people with TRICARE that shouldn't get a Medicare supplement plan. So, but yeah, they're not for everybody. But just talked to somebody yesterday and they didn't have anything. They just had Part A and Part B, and that's it. I'm like, wow, unless you got like $1 million in under your mattress, then you're exposed to a lot of financial risks there with just having Part A and Part B. You really have to get something to cover those risks. And now's the time to change your plan if you're interested. So call chapter there. All right. So living on Social Security alone. So all the people out there on Medicaid, on Medicare, with the Medicare Savings Program. And that's another thing. If the Medicare Savings Program, if people lose Medicaid, and therefore they lose that assistance paying for their Part B premium. I know a lot of people out there are just going to say, I just can't afford the $185, and I guess I'm not sick right now, and I need the $185 this month. So I'm afraid a lot of people are going to just stop Part B, not pay for their Part B, and when they do get sick or get injured or whatever the case may be, they're going to be, completely exposed, and they're going to not have any health care. So it's a difficult situation that we really need to address. And I just did a video. I've remade this a few times, but check out this video. Living on Social Security alone. It's not the best thumbnail. Anyway, I tried Chat GPT for a thumbnail, and that's what it gave me. And I figured I'd try. And so, hey, what are you going to do? Anyway, but yes, watch that video. I've got about 50 different program suggestions out there for people struggling on a monthly basis. Watch that, and I go through 50 different programs, about 48, 49. Different programs that might make your life a little bit easier, including the Medicare Savings Program, Medicaid, and that's also in there, but a whole bunch of other ones. So make sure you check that out, share it with your friends and family. We really need to get help out there, and we need to make sure our politicians, because and essentially, why are they looking for cuts here? Because they've got a couple of a few trillion dollars they want to give to the wealthiest Americans and corporations. So they've got those cuts they need to finance, and they're attempting to finance those cuts off of the poorest of Americans, unfortunately. So let's make sure that doesn't happen. And I will put the references, the article, and their wish list for cuts. I will put that in the description of my YouTube channel. All right. So I think we went through the list, and this is the time we move into our question and answer period. So if any questions on any of that, any additions, anything you want me to talk about, let's jump in there. Terry asks, how long does it take to get spousal benefits after applying online? Weeks, months? Well, under normal circumstances, if you provided all the documentation, the marriage certificate, divorce decree, if whatever is applicable in your particular case, then it's pretty easy. But this is not regular circumstances. It's not where the Social Security is at a 50-year low in terms of staffing. Politicians are trying to choke Social Security out, drown it in a bathtub by death of a thousand cuts, by not providing Social Security the resources they need to help you and get your claim adjudicated and get you your money. And that's their conscious decision to destroy customer service. And we're smarter than them. That's why you're going to reach out and tell them, hey, improve customer service. But normally, a week or two. But nowadays, maybe a month, if you're lucky. So yeah, it's unfortunate. We really got to reach out to our politicians and have them fix this thing. A lot of people are getting essentially cuts are happening right now because people aren't being able to get through the phone. They're not getting the benefits they earned and need. They're losing money because they're not getting in there in time, and they're losing months of benefits. Just went to Costco. 2025 is going to be expensive. That 2.5% cost of living increases isn't going to cut it. Yeah. Um, yeah, people like to make the cost of living kind of political, but it was taken out of the political realm in the early 1970s. So the cost of the cola, the way it's configured now for the last few decades, um, it's just the number crunchers look at how much a basket of goods was the third quarter of last year, and they compared it with the third quarter of this year, and they say, okay, the prices of this basket of goods went up 2.5%. So that's how they do the cola. So it's not political. That 2.5 wasn't given to you by Biden or Trump or Obama. The 8.7 wasn't given to you by Trump or Biden or Obama or Clinton's or anything. It's just based on the inflation in that particular time. So I guess in some respects, the inflation last year was good because it only went up 2.5%. The issue is how they calculate it. That really needs to change. Right now, for the last several decades, that number has been determined by what's called the CPIE, or excuse me, the W, the Consumer Price Index for workers, regular younger workers. What it should be based on is the CPI E, which is the Consumer Price Index for elderly. So the basket of goods should include more healthcare type stuff because once you get older, you have more healthcare costs, and that's what it should include more than the younger workers. So if that was the case, then even then the cola for this last year would have for this year would have been maybe 3.5, 4% or so. Not a whole heck of a lot of difference, but hey, every 1% helps, right? My friend was separated from his wife and received SSI and Medicaid. Now they have reconciled and he lost Medicaid. He's turning 65. Can he still get Part A off his wife's work record? Yes, yes. But it separated me no relevance whatsoever in any of that. He could, if he was divorced and he was married to her for 10 years, then he could get benefits off that record. But if they're just separated, Social Security considers them still to be married. So, yeah, if he is not insured for Medicare on his own record, then absolutely he can file for benefits on her record. But she has to be receiving benefits. So if she's receiving benefits, then he can file for benefits on her record and get Part A and Part B. Part B he'll still have to pay for. Um, our politicians had just voted themselves a 3.8% raise. Should it have been 2.5 at all? Yeah, their argument is there's internet myths going out there that they raised their pay by 40% or something like that. I'm not going to tell you who is perpetuating that internet myth, but anyway, um, they're saying, well, they haven't got a COLA increase in years, and therefore they didn't get one last year, and we got what 3.2, and the year before 8.7. So their argument is, so I could see that. I mean, that sounds reasonable, I guess, right? Logical, yeah. So, oh, thank you, Take and Took, always looking out. I have been offered a hearing. What is the best practice, in person, online, or phone? Whatever you're comfortable with. So you have an administrative law judge hearing on your disability case or whatever the case may be. You can do it at whatever you want, whichever you prefer. The Yeah, it's whichever you like. The judges, I think they prefer like an online or phone type stuff rather than having to go into the courtroom. They can sit at their desk and do so. If you want to, you know, maybe that is as an attempt to appeal to the judge a little bit more if they have to actually walk into the courtroom, which is maybe like two doors down from their office. and get dressed up and stuff. I don't know. So yeah. So, but it really depends on you. It doesn't really matter, I guess, in the big respects. So, let's see. 10 years CSRS, the old civil service for federal employees, ended in the 1980s. No Social Security deductions. Okay, the old federal employees before the 1980s did not pay into Social Security. Politicians did not pay into Social Security. Since basically 1983, everybody's paid into Social Security under the new system, including politicians. And that's the new system is FERS, Federal Employee Retirement System. With Postal Service plus additional years in private industry, will I get benefits increase with the Social Security Fairness Act? You will get more percentage. Yeah, if you have been wept, a windfall elimination provision, then the law just got rid of. They just overruled the law, and now they've got this other thing which I disagree with. But yes, if you get a higher percentage, then you will get a higher percentage. You will get a higher percentage than anybody else in your particular certain in similar circumstances, and that's what's not fair about it, that you get 5, 10, 15, 20, 30% more than everybody else, and that's why it's not fair. But I am tired of beating that dead horse. Anyway, so I'm going to do one more video on that. But my mama is a GREET, I assume a green card holder, and eligible for SSI benefits, and she never worked. I USA and 76 years old. Okay, all right. All right. I just heard Biden took money out of Medicare for EV rebates. Didn't repay the money. So sad. Yeah, that sounds like it's a internet myth going on there. Can we expect that simply applying for Social Security at age 62 online will go smoothly? Or should we expect to be difficult as well? Heard last month that applying to 30, 60 days should be fine. Still the case? Um, yeah. So if you're going to be starting your benefits at 62, remember you have to be 62 the entire month. So if you turn 62 February 15th, you can't get your benefits for February. You get your benefits in March, and then your March check comes in April. So yeah, if it's online, you've checked your make sure you check your earnings record. That's the most important thing. That's how they determine how much your benefit is going to be based on your earnings record. So go into ssa.gov, check your earnings record. But yeah, hopefully it goes through well. You push the button and it goes to the local office, or they have the regional office sometimes helps out with those. And if there's any questions, they'll reach out to you. But hopefully they just push the button and get you your money. Husband, Navy retired, just got a letter about it for Part B, but he is receiving that. Okay, let's see what we're talking about here. So, husband is receiving SSDI and just got a letter about Part B. Yeah, when you're on SSDI, Social Security Disability Insurance, after being on that for 24 months, you automatically get signed up for Part A and Part B. So, if that's the case and he wants it, he doesn't have credible coverage. That means he doesn't have like health insurance from work, yours or his. And if he does have health insurance from current employment, yours or his, that employer has to have 20 or more employees. If that doesn't apply, then he needs to go ahead and get Part B, and then figure out how to cover the gaps, and reach out to Chapter, and they can go through all your options and explain whether he does or does not need and Part B, and if he needs another plan. If he's military, maybe he's got TRICARE, and then he probably doesn't need another plan, but they can help you out. Lisa, you are awesome. Thank you. So disabled on SSDI at 60, husband passed at almost 68. Do I have to take survivor or widow benefits and get the widow's cap? No, you don't necessarily have to. You can file for survivor benefits at 60. Yeah, the widow's cap is if your late husband, filed for benefits early. So if he did not file for benefits early, or if he was receiving disability, then the widow's cap really won't apply to you. But if you're not 100% sure, I would reach out to Social Security and do this, and call and sit on the phone for hours, and hopefully you get through to a human being. And while you're doing that, you go on to your politician's website and say, click on the little button that says, I need help with a federal agency, and click on that and say, here I am. I am waiting for 2.5 hours to talk to someone, and what are you doing to improve that customer service? Okay, so somebody put in a comment in the um, YouTube that she was on the phone for like 3 hours, and then um, the person on the other side was saying hello, 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 hello. She had fell asleep. Uh, yeah, waiting so long. So yeah, it's this is a conscious decision by politicians. But anyway, okay. So call Social Security, and if you get through, tell them you want to file for survivor benefits, and they will set you up an appointment, phone appointment, and off probably a phone appointment, and then you apply for those survivor benefits. But you say don't adjudicate it, don't push the button, don't do anything until you give me my numbers. Once they run the numbers, they will tell you, okay, you're 60 years old, you're going to get X amount. And then what you do is you say, okay, how much am I going to get this time next year? So if I start in January of 2025, how much? If I start in January 2026, how much? And that'll give you an idea how much of increase there's going to be, and whether you want to go ahead and file now or file next year or the year after. So it's good to have the actual numbers based on your particular situation. Survivor benefits are kind of wonky to calculate because it depends on your age. Obviously, you're going to get decreased because you're taking it at the earliest possible time, 60 years old, and it depends on when your husband or ex-husband filed for those benefits early or delayed or whatever the case may be. So, Wayne, I wonder how many seniors and low-income folks voted for Trump. They got what they voted for. Yeah, yeah. Uh, Most of the 9 states that are gonna get those trigger automatic Medicaid cuts, yes, voted for Trump. So, there's that. D d d Amazing the calls I get with this bull. Are you talking about Medicare? Yes. They're supposed to stop that as of October 1st of last year. Medicare, CMS, the one that I guess Dr. Oz is gonna be in charge of. We'll see what happens there. I'll give him the benefit of the doubt. But Center for Medicare and Medicaid Services said, "Hey, you can't cold call people." So, like chapter here, like if I say, "Hey, chapter Bonnie wants you to call him. Can you give him a call?" And they say, "No, we can't call him." Why? Because Bonnie has to reach out to chapter first. So Bonnie's uncle or brother or aunt or whatever the case may be says, "Oh, okay, thanks for helping me out. Can you call my sister Bonnie?" No, we can't. They have to. She has to reach out to us first, and give us authorization to talk to her. But unfortunately, there's a lot of suspects not doing the right thing. Medicare insurance companies and agents out there that are calling you, and they're not supposed to be doing that. They're really not supposed to be doing that. So it's kind of the same way when you go into those big box stores and you see a "Ask Me About Medicare." That's the reason there's a sign that says "Ask Me About Medicare" is they can't talk to you until you actually ask them about Medicare. So, yeah. So which is good. So, my 55-year-old son is on disability through the military, Marines, hoorah. Can he apply for SSDI or is it one or the other? No, it is not one or the other. Please tell that jughead, that jarhead, interchangeable there. And I'm an old Marine Corps sergeant, so I can say that. So yes, please tell him to go ahead and apply for SSDI. His military veterans, disability has nothing to do with Social Security disability. No effect on it one way or another. There is one positive effect because probably most of his medical records are with the VA. The Social Security Administration talks to the VA a little bit better, and therefore they get the medical records a lot quicker. So yes, please tell him to reach out. I've got a few videos on how to apply for SSDI and tips, tricks, and secrets. So watch those videos. But the important thing is to get the process started immediately, if not sooner. So reach out to him right now, get off YouTube, call them up and say, "Hey, let's apply for disability." You can call and schedule an appointment, but I would do it online, because when you do an appointment, the claim specialist, the employee at Social Security, they're so understaffed and it's just crazy, that they have a bunch of appointments for that day. and they might rush you a little bit. They shouldn't, but it's the reality. They've got a lot of people they're trying to help. And you don't want to be rushed when you file for disability. So that's why I recommend going online, and that way you can sit there and fill everything out and take your time, get a big cup of coffee, get your doctor's names and addresses and phone numbers and dates when you saw them, and you get your prescriptions and all that kind of stuff, and just sit down there and do it to it. So, Dr. Weir, have you heard of the state of Tennessee denying veterans of the armed services for Social Security, saying they are not American citizens because they had lived in Canada? Their parents were Americans. Yes, that is everywhere. And unfortunately, I have to tell you, I have had a couple of those cases in my career as well. It's always, yeah, that's, being a vet myself, it always hurts. But I always give this as an example of people always saying, "Oh, Social Security, they're giving it out to illegals and stuff like that." No, stop that's the politicians trying to distract us, and we need to be smarter than these politicians, which ain't difficult. Anyway, but yes, I've had a couple of cases, and this is probably the same type of situation where the parents came over from Canada in the 60s and 70s, and they didn't do things correctly. And, the kid, I've had a couple that served in Vietnam, Silver Star in Vietnam, Bronze Star in Vietnam, and they come in and file for retirement. And I'm like, you were born in Toronto or Quebec or wherever. And I need to see your green card or your naturalization. They said, I've served in the military in Vietnam. Yeah. So they have to prove that they're in the country legally, and it's crazy unfortunate. So I would reach out if this person does not have, um, if they do not have the proper documentation that they're in the country legally, passport, naturalization, green card, or whatever the case may be, then in that particular case, I always tell them to reach out to the politician to expedite the entire process, because this person is a veteran and served, and yeah. So their parents were veteran for Americans, and so what that basically is yeah, they didn't do their documentation correctly when they came over. The child is probably a U.S. citizen born abroad, but the parents didn't do the documentation correctly. And in the 70s, nowadays you can't get in the military unless you prove all that kind of stuff. After 9/11, it's a lot more stricter. But in the 60s and 70s, particularly in Vietnam, it's like, yes, can you see this? Then you're drafted, right? So yeah, yeah, it's unfortunate, but yeah, they have to get proof that they're in the country legally. So, and that's an example for all those people out there that saying, the trust fund is going to illegals and stuff. No, that's not correct. Stop Medicaid. Okay. All right. Share to everyone the difference between the Medicare Part B premium and someone who is seeing a Part B deductible. I know what is some, but here may not know the difference. Yeah, so the Part B premium is the $185 you pay per month, every month. That if you're getting Social Security, it immediately comes out of your check. And then the first time you go see a doctor or clinic or hospital or whatever the case may be, you pay a one-time deductible, and that is $257. If you have a Medicare Advantage plan, then you may or you don't necessarily pay that Part B deductible. You might pay some other type of deductible or something. But if you have a Medicare Supplement Plan N or G, then neither of those pays that deductible, the $257. So if you have, if you go in there and you have $1 million um, treatment or therapy or operation, and you have a Medicare Supplement plan, you will pay $257. And then the other 999,900, whatever, is paid for by Medicare and your Medicare supplement plan. So those are the difference. Bonnie, make sure to like and share. Yes, please, please, please. Thank you. So this information, yeah, a lot of people out there that are on Medicaid, as I mentioned, how many did I say? On Medicaid, 80 million people on Medicaid. And so if they lose their Medicaid, they're going to lose their health insurance. And so those people need to know what might be coming down the pike, and to reach out to the politicians and make sure they get that, make sure they stop that. I had to retire at 62 because of my other half had terminal cancer and needed my care. Wow. I will be 65 in June. Do I need to make an appointment now to get signed up for June? Not sure what we're talking about. No, you really don't have to do anything. If well, by retiring, do you mean you had to start your Social Security benefits at 62? If you started your Social Security benefits at 62, you don't need to do anything else. You're done. If you're going to be 65 in June, you will receive your Medicare card, your Part A and Part B in the mail. If you don't need Part B, you can refuse Part B, again, if you have credible coverage. But yeah, you need to. If you're not talking about that you started receiving Social Security at 62, and you want to start your Medicare or money benefits at 65, yeah, then you need to reach out and file an application. And since you're 65, you need to find a plan, either Medicare Supplement, Medicare Advantage, Part D plan, and all the rest of it. So reach out. Now's the time to reach out to Chapter, and they will go through all your options and see if you actually do have to manually enroll or whether it's going to be automatic, and they can help you out. So. But they keep sending dollars abroad. What? Yeah, that's again, and that's another distraction. We're talking about two different things. So your Social Security money is not going abroad. It's not going, to Ukraine and all these other crazy internet myths. Again, that is a distraction politicians are using. There's $2.7 trillion in the Social Security Trust Fund. It's there. It's being pulled out every month to put in people's checks, and the problem is just running out. So we need to focus, keep our eyes on the prize instead of being tricked by politicians. And, hey, look at you know. Anyway, I tried to contact the senior centers in my area, and they didn't even know what they were trying to do with our Social Security and had no idea. Is there a way I can get a copy of what you have? You can send them my YouTube channel with over close to 1,000 videos. Um, yeah, I'm not sure what and what particular reference. If they cut Medicaid and SSI, then what will those less fortunate people do? Sad. Exactly. 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 And then I like how you put that less fortunate because, it could, for pure dumb luck, it could have been us. That's all it was. Remember that time you were driving through the intersection when you were 26 years old, and that drunk driver, you know, went through the red light and crashed into you, and ever since you've been on SSI and disability and welfare because you couldn't work? You don't remember that? It could have happened. So, so we need to understand that, a lot of and again, they'll roll out one person that's, the old Reagan welfare queen and stuff like that. But come on, we're smarter than these politicians. If you haven't done so yet, don't forget. Oh yes, please say yes. Everybody's looking out. This is awesome. Y'all are looking out for the community. We have Cobra for 12 months, paid by my husband's company. He signed up to be on Medicare Part B for when Cobra ends. Good. Medicare put him on Part B right away. Will Cobra still be a payer procedure? Yeah, you'd have to reach out. That whole first payer, second payer, and all that kind of stuff is a nightmare. Since your Cobra is a private company, I'm sure they're going to want to, make Medicare pay everything they possibly can so they save money and make more profits and stuff like that. So we need to stop these politicians. Exactly. He just said there's more people on Medicaid than Medicare, so no wonder this country is in trouble. Yeah, I mean it's the whole Medicaid, Medicare, the Affordable Care Act, the CHIP, the Children's Health Insurance Program. Yeah, just a hodgepodge of healthcare. We just I believe we should have kind of Medicare for all. That is. Um, Dr. Oz has always been a proponent of Medicare Advantage for all, which, okay, since there's already a system called Medicare Advantage, okay, but obviously everybody knows two things need to be addressed. If it's Medicare Advantage for all and those prior authorizations are still there, then no, thank you for me. If it's Medicare Advantage for all and it's still those limited networks where hospitals and doctors are not wanting to take Medicare Advantage at all, then no for me. And I know for a lot of my regular viewers. So, okay, if you want to use the Medicare Advantage structure, but that's fine since it's already there, but you need to fix this, 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 and this. And then, then it turns into kind of Medicare for all, right? So, anyway, So those are what we need to voice is to go out there. Shared every the difference between the Medicare premium. Oh, okay, already talked about that one. Have you contacted your senators and House representatives? Exactly. Yes. Yes. Yeah. Mine are tired of hearing from me. I've been contacting them forever. So, I first time I contacted a politician is when I was 16 years old in high school. I contacted, President Reagan, and yeah, was Arkansas one that is getting cut on Medicaid? I couldn't see the state maps. Yes, yes, Arkansas is. And again, that's if the politicians get their get what they want to do is let me move that out there. Why did I have that up there? Yeah, so those are the states: Montana, Utah, Arizona, Illinois, Indiana, Virginia, North Carolina, New Hampshire. Is it New Hampshire? Yeah. Arkansas. Yes. So, but we need to reach out to them, and again, all states, because all states are going to have a difficulty. Those are the automatic trigger states, but a lot of the other ones are going to have a very difficult time keeping their Medicaid rolls. So they're going to have to kick people off of Medicaid, in mass, and so we don't want that. Let's see. Yes, my husband has to pay the $185. His company is huge and does provide insurance, just not for him. What can we do? He can't afford it. Oh, I forgot to mention another option. So if you can't afford the $185, you reach out to Medicaid, but there's also a Medicare Advantage Part B give back. So if you can't afford a Medicare supplement, then you definitely, if you can't afford the Medicare Part B premium, then you definitely can't afford the Medicare supplement monthly premium on top of that as well. So, an alternative is Medicare Advantage, and within Medicare Advantage is called a Part B give back. And what it is if there's one available in your area, then as the name implies, it pays for your Part B, part of your Part B, $50, $100, $185. Um, but you can reach out to chapter and they can find out if there's one available in your area. But be careful on those, because these are health insurance companies, and they just don't give you 100 $185 to pay for your Part B out of the goodness of their hearts. They take it out of other places. So if you're healthy and you don't intend on getting sick or being injured this year, then, yeah, Part B give back, get that extra money in your pocket. Beautiful. Next year, change to maybe keep it if you're still healthy. But the thing is the insurance companies, they give you that money and they take it out of someplace else. So on a normal plan, you might pay $100 a day for a hospital, but on the Part B give back, you might have to pay 200, 300, or $50 for an MRI on this one and $300 for an MRI on that one. So, insurance companies ain't stupid. They know, where to make their money. So, but if you're healthy, yeah, Part B give back all day long. And veterans really like the Part B give back. So if you're a veteran, a lot of the plans are actually kind of directed towards veterans. They're called honor plans and patriot plans. So if you're a veteran that uses most of your health care you get from the VA and you're happy with it and everything, but you want to keep Part B as a fallback, which is a very, very good idea, but you don't want to pay the $185, get one of those Medicare Advantage Part B give back, the honor plan or the veteran plan, and have your cake and eat it too, right? A lot of those plans, for the veterans, the honor plans and stuff, don't include prescription drugs in those, because the VA has far better prescription drug program than Medicare, because the VA can negotiate prices with the pharmaceutical companies. Revolutionary idea, right? That's another thing that might be on the chopping block, is because Biden, under the Inflation Reduction Act, now they're able to negotiate prices. Medicare is able to negotiate prices, and they've just negotiated the first 10 that will start in 2026. But yeah, the next administration might, forget that, because pharmaceutical companies want to make tons of more money on us. Charge us $100 a pill, and then people in France, dollar for the same pill. I'm 63 and thinking of retiring. I'm eligible to continue my health plan through my employer post retirement. Will I still have to apply for Medicare when I turn 65? You'll have to apply for Part A when you start your money, because that's mandatory, but it's zero premium. But No, if you 100% don't want Part B, you don't want to pay for the $185, you don't have to. But if you change your mind later, if you're because this is a retirement plan, this is not through current work, so that there is no exceptions. Um, so if you change your mind 5 years from now and want Part B, or if the CEO takes all the money and heads off to the Cayman Islands and you no longer have health care, then when you go sign up for Part B, you're going to be penalized 10% for every 12 months you did not have Part B. And Part D, the prescription drug plan, you're going to be penalized for that 1% for every month you did not have Part D. So the drug plan. So you can take your, if you really, really don't want it and your company's health plan is going to be around there forever and they're never going to make you sign up, then, it's your choice. But yeah. Um, let's see. Divorced spouse met all requirements, took at 63, now 65, told at time best my early money and rest from X would be included to have 50%, but only getting 35%. Wasn't what I told, less than 600. Um, so yeah, anytime you take money from Social Security early, it's reduced. So you're full retirement age now, and so you definitely won't receive 50%. So if you took it at 63, yeah, sounds about rightish, about 35%. So that sounds about right. And it's not going to increase once you reach your full retirement age. Once you took those reduced benefits and you continue to get those benefits, then it's not reduced, or excuse me, it's not increased. Here's an idea: cut off war money and give it to our people. Yeah, I mean, talk about fraud, waste, and abuse. I saw a lot more fraud, waste, and abuse when I was a sergeant in the Marine Corps than I saw when I, ran my office at Social Security. So, yeah, it's a crazy amount with those contractors and stuff. Those $10,000 hammers and all that stuff. Wife, wife on SSDI at 50. Now 63, $640. I'm almost 65 to start Social Security. What happens to her SSDI and spousal benefits? Is it cost advantage for her to wait for spouse benefits? Any suggestions? Yeah, once you file, she's supposed to file. It's called the deemed filing. So once you start your benefits, she should start her benefits because she's at least 62. And what will happen is you file for benefits, then you hand the phone to her. And if your benefit amount is over twice hers, then she'll get some more money off of your record. So, and it won't affect her disability. So if she gets more, once she files for spouse benefits, then disability, it's not as though disability is going to stop. Her disability will continue. And what people are paranoid about is, well, I don't want the extra money because then I won't receive disability anymore. And that's fine, but I'll lose my Medicare. No, she'll still get disability. She'll get some extra money off of your record, hopefully, and her Medicare will continue. So that's not an issue. Uh, da, da. Rochelle, is this live right now? This is my first time here. Yes, Rochelle, welcome. This is live. Yes. I'm jumping around here. We got tons of questions, so I'm trying to find people that I've never seen before. If I cut out Medicare, could I get that money back in my check? What are the downfall? Yes, you can cut Medicare Part B. You can call, Social Security up and say, I don't want it. They have you sign a form that says you recognize the repercussions of not having Part B. If you go back to work and you get health insurance from work, then that's fine. If again, your employer has 20 more employees and all that. But if you just stop it because you can't afford the $185 and you say, well, I'm healthy anyway, so I don't need it. Well, yeah, we're all healthy until we're not healthy. So what happens next year, the year after, and you want to go sign up for Part B, then you're going to be penalized for the rest of your life, 10% for every 12 months you did it. So, Cheryl, I would do a couple of things if you just can't afford it. Cheryl was here yesterday. She was looking out for someone, I think. Yeah. So welcome back, Cheryl. So reach out to Medicaid and see if they will pay for your Part B. That's the Medicare Savings Program, or reach out to Chapter and see if there's a Medicare Advantage dual eligible plan in your area, and to switch to that. You can switch to one. Again, January, February, March is the Medicare open enrollment period. You can switch one time your Medicare Advantage. So reach out to them. Someone looking out there. Hello, would you know if SSD tax statements and regular Social Security tax statements go out at different times to file taxes? I got mine, but hubby on SSDI, no form yet. Um, yeah, they have contractors that print those out and stuff like that, and I'm not sure whether they do different contractors, different printing, mailing companies and stuff or whatever. So, yeah, I've never known them to go out different times, but it's usually it's not based on the program necessarily. It's based on the Social Security numbers. I think they differentiate it by okay, hey, we'll do the last four or the last three of the Social Security numbers will print off, this million letters, and the next day another million letters and stuff like that. So, yeah, they do it like that. So, let's see. Be sure to wait for full retirement age if possible, but get something if it's not possible or feasible. Yeah, it's when you start your Social Security benefits, completely 100% based on a lot of your particular situations. Yep, whether you need the money and all the rest of it. I am supposed to call Medicare and cancel my Advantage plan. Anyone know the phone number I need to call? Yeah, you don't really um, yeah, you call 1-800 Medicare. I'm not sure they can cancel. Not sure. Did you want to go back to original Medicare? In that case, the best way to do it is you enroll in a Part D plan. So once you enroll in a Part D plan, a prescription drug plan, that means a standalone prescription drug plan. That means you have opted out of Medicare Advantage. But then remember, you have to get a Medicare supplement plan unless you got $1 million to cover all the gaps. But yeah, you can reach out to your Medicare insurance agent; they can help you out, or you can reach out to Chapter and they can tell you the procedures. And I think they've got a little; they'll send you an email and it tells you all the procedures of how to do this, that, and that, and they'll help you out. So, and their help is 100% free. Um, Oh, and speaking of, I thank the heavens above for your channel, Dr. Ed. So many of my family members and friends have called Chapter and they've been helpful. Thanks again. Awesome. Good. And David for Chapter. Right? All right. Good deal. Yeah. When I first started this channel, I didn't want to get into, Medicare supplements and Advantage and stuff like that. I help people with, the retirement disabilities, Medicare Part A and Part B, but so many people needed help. And there was so many just shady Medicare insurance people out there. I'm like, yeah, we got to find something better than that for people. My husband is retired. He's 67. I'm still working at 62. Can he collect on my Social Security if it's more than his? I'm still working. You have to file for benefits because you called him my husband, so that I assume you're still married. But no, you have to start benefits on your record before he can start spouse benefits on your record. So, will it affect what I collect when I take mine benefits at 67? No. Again, you have to file. So if you start your benefits at 67, then he can start spousal benefits on your record and it won't affect your benefit at all. It's completely separate. So, Christina, my son was schizophrenia with bipolar mania since he was 16. He's been on disability and now he's on Medicare Part A and Part B, and I have to pick him a plan so he doesn't lose his medicine and be able to go. Yes, reach out to Chapter and they can definitely help you out. They'll ask you for your zip code and find the plans in your area. And then they'll ask about what doctors he sees, what prescriptions he takes, and they'll look through all the dozens of plans in your area and give you a few recommendations and help you get all set up. So, Anna, 55 years old, currently 17 years of taxes paid to Social Security, leaving the country soon. Would I still be eligible to apply for Social Security in the U.S.? Will be my current Social Security earnings dramatically reduced or stay the same? Well, Social Security determines your benefit amount by your high 35 years, so you're going to have a bunch of zeros there. But hey, you paid into Social Security at least 10 years, so that's your money. Yeah, one thing I would recommend if you're going to be leaving the country, I would definitely file for benefits before you left, because a lot of people, they leave the country and they go overseas, and then they have to go through the embassy or the consulate, the federal benefits unit, and that's a nightmare. Someone was just saying yesterday that they have to take they've scheduled an appointment at the federal benefits unit in Manila, the Philippines, and it took them 7 months to get an appointment. So it's always good. A lot of expats heading overseas. It's always good to get all that stuff set up before you leave the country. So, Let's see. When you go on TV and radio, please use the analogy of the beat up guy on the side of the road. Very relatable. Also, what is ARP doing to lobby for Social Security? Yeah, that's yeah, the beat up guy. I said that a few times. President-elect Trump, he said, "Okay, I'm not going to cut benefits. Perfect, awesome, we like that. I'm not going to raise the retirement age by 1 day. Perfect, we like that." But the problem is that there are automatically going to be cuts here coming in the very near future. So we're looking at about 21% cuts in 2034, probably closer to 2033. If the next president does some of the stuff he's talking about, there's going to be 33% cuts. And I've got all the references for this in my description in YouTube there. So it's kind of like a beat up guy along this, that's in the gutter, and you walk by and said, "Hey, are you going to beat up on this guy anymore?" "No, not going to beat up on this guy anymore." "Oh, okay, cool. Let's go get a beer." "Are you going to beat up on Social Security more?" "No, we're not going to beat up." "Well, we're not going to do anything to fix it, though. We're not going to call an ambulance or, stop the bleeding or anything like that. We're just going to walk away. So, unless I haven't seen anything that the next president said he's going to do to actually stop the cuts in the future, he just said he's not going to do it on his term. And that's fine, but what are you doing to solve it? The automatic cuts that are going to happen. So that's what needs to be addressed. And yeah, yeah. And the Social Security Unfairness Act, which is just political theater. Yes, the 3% that's getting the extra money. Yes, I'm sure they're happy. But the other 90%, 97% are not getting an extra percentage like this 3%. And it wasn't to expand Social Security or protect Social Security. It does the exact opposite. And us and the mass media just fell for it. So, yeah. And the reason why did President Biden sign the Social Security Fairness Act at the last minute? Because he knew that President-elect Trump was going to sign it because it had bipartisan support, Democrat and Republican, and Biden signed it because he knew that Trump would have signed it. So people say, "Well, he did. Why did you put Trump's face on your thumbnail?" Because the reason Biden did it is because he knew Trump would do it, and get the credit for protecting and saving Social Security, which doesn't protect or save Social Security. So, um, yeah, yeah, politicians think we're dumb, but my audience is not, because we're informed, right? Just announced today, you will hear it soon. It wasn't paid back, but the fact that any money is taken from the fund is wrong. TJ just announced today. You will hear it soon. It wasn't, not sure what that was talking about. Um, let's see. Social Security is a ripoff. It is taxed twice. It is progressive on outside and regressive while working. End it now. A ripoff. Tax twice? Yeah, I agree with you there that, it's a tax, a payroll tax, and then when, not 40%, 40% don't pay tax on their Social Security benefits, but the other half or so does. And I agree, yeah, I don't think it should be taxed. But if the next president stops taxation, that's one of the reasons why the benefit cuts are going to come sooner and deeper, because that taxation puts money into the trust fund, billions of dollars. So that's another billions of dollars of a hole that is not going to be there. So, is it possible to draw off my wife's Social Security? She's 70, I'm 65, until I reach my FRA without a penalty. No, you have to file for benefits on your own record. So you have to do two claims. You have to file for benefits on your own record and then file for benefits on that person's record. So a penalty, it's reduced because you're filing early. Is a Medicare PDP plan considered an Advantage plan or a supplement plan? It looks like an Advantage plan, A, B, and D. So Advantage plans, most Medicare Advantage plans already have the Part D plan embedded in them. Vast majority. There's what I talked about earlier, the ones that vets like, those MA only, Medicare Advantage only plans, that don't have the prescription drug in there, but most of them do have prescription drugs in the Medicare Advantage plan. When you sign up for a Medicare supplement plan, the plan N or G or F, those do not have the prescription drugs in there. So you have to sign up for a standalone Part D plan, and that's where a lot of people make mistakes. Is they, turn 65, do the right thing, sign up for a Medicare supplement plan, but then they say, "Well, I don't need a prescription drug plan because I don't take drugs," and they don't sign up for it, and then year, 2 years, 3 years, 4 years later, they get a prescription they have to fill, and they sign up for Part D and they're penalized for the rest of their life because they didn't sign up when they were supposed to. So, yeah. All right, let's do one last question here. My sister is 70 years old, widow, married to an illegal person. Can she get benefits from him? Um, no, doesn't sound like it. Because it doesn't, if he was not in the country legally, didn't have a social security number, then no. Uh, so maybe that person actually paid into Social Security because there's estimate is about $37 billion every year goes into the Social Security Trust Fund from people in this country working illegally under a fake Social Security number, or they came over to the country legally on a student visa or something like that, and they got a Social Security number, and then they just stayed, and they're supposed to go back to their country. So there's people that paid into social that are paying every year into Social Security that will never get that money back, including in this case, unfortunately, your sister. So that is a contribution that $37 billion a year that's going into Social Security that they'll never get back. So, all right. Oh, Rocketman, thank you for the support. Thank you, appreciate it. What are the requirements for filing for Social Security? Also, if you don't get the total 40 credits, can you still file for it? You can file for Social Security if you don't have the 40 credits, but you're going to be denied because you don't have the 40 credits. You're not insured. If you're not insured, that doesn't matter if you have a spouse or a divorced spouse that's insured and you are eligible on that person's record. So there's a lot of people that don't never paid in Social Security, never really worked that much, but they are eligible for Social Security because a spouse or a divorced spouse or something paid into it. So, all right, that is it for today. I'll be back